first cranial nerve we're going to test is cranial nerve 2. I'm just going to ask you to tell me how many fingers I'm holding up. Like, look right at my face. Tell me how many fingers I'm holding up when I hold up a finger, okay?
Mm-hmm.
Okay.
1, 2, 3, 6.
Okay.
Whew.
Good job.
Thank you.
Next, I'm going to be doing a fundus assessment, so I'm going to be looking into your eyes. So I just want you to look right over my shoulder as I'm standing. I don't know if you can see me, so I'm standing right here, okay?
Mm-hmm.
And I'm going to be looking into your eye, and I'm visualizing the red reflex. Just keep looking over my shoulder. That's okay. Visualizing the red reflex, and I'm just going to come in closer to your face, and I'm looking into his eye, and I'm visualizing the optic nerve, and the fundus, and the optic disc. Just keep looking over my shoulder for me, okay?
Mm-hmm.
And I'm visualizing the color, and just keep looking over my shoulder for me. I'm visualizing the color and everything else. Everything looks good. That's also cranial nerve 2. For cranial nerves 2 and 3, I'm going to be checking your pupils. This is going to be a little bit of a bright light. I'm very sorry about that. But I'm just going to ask you, I'm just going to help you keep your eyelids open, okay?
Mm-hmm.
I just want you to keep looking right over my shoulder as I'm doing this, okay?
Yeah.
You can look at my shoulder if it's
Okay.
more
I
helpful
don't
to
know
you.
why.
That's okay.
Mm-hmm.
So just keep looking at my shoulder, and when I'm doing this, I'm checking for direct constriction, which means that his pupil is constricting on the side I'm testing. And then I'm checking for, you good?
Mm-hmm.
I'm checking for constriction in the other eye, which is consensual. Just try to keep both eyes open for me. Consensual constriction. Good. And then, done with the light. Sorry, I know it's bright. I'm going to place my finger close to your eyes, and then I want you to look at my forehead, and then look back at my finger. And I'm checking for near constriction, which means that his pupils are constricting as they're looking at the nearer object. So that is cranial nerves 2 and 3. For cranial nerves 3, 4, and 6, I'm going to be checking your 6 cardinal positions of gaze. So just follow my finger with just your eyes and don't move your head, okay?
Mm-hmm.
So 6 different positions of gaze. Good. And with that, I'm looking for smooth movement, no nystagmus. I'm looking for no shaking of the eyeball and stuff like that. Now, cranial nerve 5, I'm going to be checking the feeling of your face for cranial nerve 5. So I'm going to be checking light touch first. So close your eyes. I'm going to be touching your face with just a little bit of a cotton ball, okay?
Mm-hmm.
So say yes when you feel me touching your face.
Yes. Yes.
So that was ophthalmic.
Yes. Yes.
Maxillary, and then because he has a beard.
Yes. It tickles.
And
yes.
that's mandibulary. And I'm going to do the same thing, but with a little bit pointier of an end, okay?
Mm-hmm.
Keep your eyes closed. This is checking a sensation to sharp touch.
Yes. Yes. Mm-hmm. Yes. Yes. Mm-hmm.
Good. That's cranial nerve 5. Now for cranial nerve 7, I'm just going to be checking some of your facial movements. So just scrunch your eyes closed for me and open them wide. And now frown and smile and puff your cheeks out. And I'm looking for ease of movement, smoothness of movement for that. Good job. You're all done.
Thanks.
Cranial nerves 8, I'm going to be checking your ears, all right? So I'm going to touch your ear. I'm going to be plugging one, and I'm going to whisper 2 words over here, and I want you to repeat them back to me, okay?
Mm-hmm. Apple vinegar.
Good. I'm going to do the other one.
Mm-hmm. Cat dog.
Good. Good job. And then for cranial nerves 10, I'm going to be checking your soft palate. So I want you to open your mouth, say ah. Just kind of looking with the light, okay? Do it one more time. Good. So for that, I'm just looking for the lateral up and down smoothness of movement with your uvula. Mm-hmm. And then I'm also going to ask you, can you give me a forceful cough? Good job. One more time. Just like a good. And so we're just checking for like a good response for that, like a good huff, a good effort. Cranial nerve 10, I've also been assessing this entire time as he's been talking to me. I'm, can he enunciate? Is his tongue moving well? Are you able to swallow? Have you had any trouble swallowing? Good. Cranial nerves 11 is the spinal accessory nerve. So I'm going to be checking some of the muscles around your head. So I'm going to put my hands on your shoulders and just raise your shoulders up against my hands. Good strength there. And then I'm going to check his sternocleidomastoid muscle. So that's okay. I'm just going to place my hand and give a little bit of resistance when you're turning your head, but try to turn good. And then try to turn the other way. Good. And and try to raise your head up. Raise your chin up.
No, sorry.
And then put your chin down. Great. So good strength there. No shaking, no spasticity or anything like that. So those are the cranial nerves. The next thing we're going to move on to are reflexes. So the first reflex I am going to be checking for him. I guess I'll start with this one, if we can see, is the bicep. So while we're doing this, I just want you to kind of try to relax your arm as much as possible. And then just bend your arm up for me. And I'm feeling for the tendon there, and I'm putting my thumb over it. And just relax your arm down and let it dangle nicely. And then we're looking, good job. We're looking for just a little bit of a flexion in the elbow and a contraction in the bicep there. And then we're going to check the tricep. So I'm just going to have you kind of just relax your arm. I'm just going to dangle it up there for me. And you can kind of feel the tendon on the back there, and just nice and relaxed. And I'm going to be, there we go, looking again just for a little bit of extension in that elbow there. Now we're going to do the brachioradialis. So you can kind of just relax your hand on your arm there, and it's kind of a couple centimeters up here. You hit with the flat of the hammer. And I'm looking for a little bit of supination of your palm there, okay? There we go.
Too much?
No, it's great. And then we're going to move on to the knee reflex. So if you can scoot yourself back so your knees are just dangling down. Nice and relaxed. And you're just going to be kind of hitting on this patellar tendon here. And just looking for a little bit of, are you relaxed? You can relax your foot down too. Are you far enough back on the chair? Is that as far back as you go? Sorry, I know it's not very tall. And just looking for a little bit of extension in that knee. The next one we're going to be checking is the ankle reflex. So this one you want to be dorsiflexing the foot. I want you to stay as relaxed as you can, okay? Mm-hmm. But you as the provider want to be kind of supporting their foot. And then, sorry Cleo, we're going to be hitting the Achilles tendon on the back there. And you're just looking for a little bit of, I can't get it on this chair. Sorry.
It's fine, it's the chair.
Sorry. Just try to relax your leg. I know it's hard on this setup, but just dorsiflexing the foot and then trying to get a plantar flexion. Yeah, a little bit out of the foot there, and you can kind of feel it in your hand. And then the last one is the Babinski reflex. So this one, you're stroking up, can't see, stroking up from the bottom of the foot on the outside edge up to the back of the toes. You're looking for a little bit of a curl in the toes as you kind of come up there. Yeah, just like that. Good job. And then the next thing we're going to be assessing is the sensory system. If you're uncomfortable on that, you can move to the, I don't need you to be dangling your legs anymore, thank you.
Don't mind the stack of books.
Okay. Okay, so I'm going to be checking for light touch in all four extremities. So for the purposes of this video, John has his shirt on. That's okay. I'm not going to ask him to take his shirt off. A patient of mine, I would probably be shirtless or in a gown, and I could be able to assess and have access to his skin a lot easier. But in all four extremities, we're using a little bit of a cotton swab, and I would be asking him to close his eyes, and I'm just going to ask you to tell me when you can feel this like light touch on you.
Yes. Mm-hmm.
Okay. And then we would do all four extremities. Keep your eyes closed for me.
Mm-hmm. Yeah.
Good.
Yeah.
And then again, he probably would be in a gown, so he wouldn't have these pants on, but...
Close my eyes.
Yeah, please keep your... Yeah, thank you.
Yeah. Yeah. Yeah.
Good.
Yeah.
And then this one.
Yeah. 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 Mm-hmm.
Okay.
Mm-hmm.
And then we also would be testing for pain in all four extremities. So I would have a pin. I don't have a safety pin, but I will use the pointy end of this cotton swab, I guess. It would be the same thing. So keep your eyes closed, and I would be checking. Just let me know when you can feel me pricking you with this, okay?
Yep. 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 Yep.
Good.
Yep. Yep.
Good. And I would do his lower extremities as well, but I think just for time management, we don't need to go through that again. We also will be checking proprioception, so position sense, in all four of his extremities. So I'm just going to take your hand, and I'm going to move one of your fingers in a certain way, and I want you to tell me if it's up or down. I'll ask you to close your eyes again, okay? And I'm going to...
Up.
Okay, great. I'm going to grab your other hand.
Down.
Good. And when I'm doing that, I'm grabbing from the side, so I'm not giving him any cues about in which position I'm doing it. And again, I would do that in all four extremities. I would do it in his lower extremities as well. The last thing that we're going to test for sensory is we're going to test vibration sense. So I'm going to ask you to close your eyes, and then when I ask you to close your eyes, I'm going to put this vibrating thing onto one of your fingers, and you just tell me if you can feel it, and then when you can't feel it, tell me when you can't feel it anymore, okay? So I'm just going to hold your hand out like that. I'm going to make this thing vibrate.
Yes, I can feel it.
Okay.
No.
Okay, great. So I'm starting the vibration and I'm stopping the vibration while it's on his finger, and he was able to tell me when that vibration stopped. So he's got great vibration sense in that, and I would go through all four of his extremities and do that in everyone as well, and note if any of them were different, if it took him longer to feel the vibration or to feel when it had stopped in any of them. And then we're going to test some coordination as well. So just one test for this one. So I'm going to ask you to just look at my finger and then touch my finger and touch your nose and keep looking, well, with the same finger.
Oh.
Sorry, that's okay. Touch my finger. Yeah, exactly. And then keep looking at my finger the whole time. Touch my finger, touch your nose. 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 Okay, good. So he's got great coordination, didn't have any issues with that. It was smooth movement. He didn't miss my finger. He didn't miss his nose at all. The next thing that we're going to test is motor function. So for this, I'm testing for muscle tone and muscle strength. So the first one, muscle tone, I'm going to check your upper extremities. I'm going to just try to have you relax as much as you can. Actually, I'm sorry. This is a time where I'm going to ask you to lay down, if you don't mind. We want the patient to be as relaxed as possible. Would you like a pillow for your head?
Yes, please.
There you go.
Oh, nice.
We're just going to have him be as relaxed as possible. And I'm just going to check your arm here, and I'm just going to passively, so I just want to be making all the movements so you can kind of relax your arm. I'm going to be moving each of his joints in his upper extremity quickly and then slowly. I think it's okay. Yeah, it's still going. Thank you, though. Quickly and then slowly, and I'm checking for spasticity. Like if I was going to be moving his arm quickly, that would be spasticity if I was going to feel it. And then when I'm moving it slowly, I'm checking for rigidity. So this is like muscle tone. I'm going to do that in his lower extremity as well. So I'm just going to be moving your leg up a little bit. Okay, I'm moving your hip joint. Okay. Moving the knee joint. And then moving the ankle joint. And then I'm going to ask him to do that against resistance for me as well. So just try to raise your whole arm up for me, and I'm putting a little bit of pressure. Good. And now try to bend your forearm in towards your. Good. And then try to pull your wrist in and fold it against your. Good. So I'm just checking strength in his upper extremity there as well. He's got 5 out of 5 strength I would give him.
Yeah.
We're going to do the same thing for the lower extremity, okay? Try to raise your knee, like if you can bend your knee a little bit, try to raise your knee up to your chest. Good. And then try to raise your whole leg up off the bed. Good. And then press down on my foot like a gas pedal, and then pull up on my hand like, good job. So 5 out of 5 strength all around is what I would give him, and I would be doing that for the other side as well. Then we're going to move on to the abdominal exam. So the first thing we're going to be doing is, if I had an actual exam table, I would be standing at the foot of the exam table, and I would be looking at him from below. I would be assessing for distension, any discoloration, any hernias, bulging, pulsations, any periumbilical vessels that are pretty obvious or anything like that. I don't see anything for him. He looks pretty good. Again, for the purposes of this video, we do not have his shirt off, but my patient would be bare-chested for this. The first thing we're going to do, inspect, then for the abdominal exam, we are auscultating first. We don't want to be pressing on anything that's going to change any of the sounds that we're going to hear. So I'm just going to listen to your abdomen, okay? This might be a little cold. I'm very sorry about that. I'll try to warm it up for you. Starting in the left lower quadrant. And we're going to be listening for at least 10 to like 15 seconds in each quadrant with the diaphragm. Good. Good. So I'm listening for hypoactive, normoactive, or hyperactive bowel sounds. His sound normoactive. You've got great activity going on in there. Nothing too crazy though.
No, that's good.
And then I'm going to be listening for abdominal bruise. So I'm going to be just listening again, okay, in a couple of different spots on your abdomen. I'm going to listen to your aorta in here, and I'm just listening for any swooshing kind of sounds. Sorry, Cleo, go ahead. With the diaphragm. And then the bell to pick up some different frequency sounds. I don't hear any swooshing. We're going to be listening to the renal arteries bilaterally. Midclavicular, a little above the umbilicus. With the diaphragm. And the bell. And then the other side, the right renal artery. Great. And then I'm just going to be listening to your iliac arteries in your lower abdomen, okay? So, midclavicular line, a little bit below the umbilicus. And on the left side as well. Okay, great. Everything sounds good in there. Okay, I didn't hear anything strange or abnormal. Yeah, no swooshings or anything. Then the next thing we're going to be doing is percussing. So we're going to percuss in, I'm just going to ask you to put your arms back down for me, I'm sorry. We're going to be percussing all 4 quadrants of his abdomen. And earlier he said that you don't have any abdominal pain, correct? He said he had no abdominal pain earlier. So I'm going to be, if he had, I would start with the I would go to that one last, so that he wasn't like gardening or anything. Excuse me. So we're going to be percussing and you're listening for dullness and tympany. Dullness would be more over like organs, and like fluid. Tympany would be more over like an air space. We're going to be percussing for the liver span as well. So for that, we're going to start kind of third mid-clavicular line. And you can kind of hear where the dullness starts and stops. So you kind of note where the dullness starts, and then you can move to the left or right lower quadrant. Sorry, I'm just getting a better angle on you.
You're good.
And start a little bit below the umbilicus mid-clavicular line and go up, and you can kind of hear again where it starts. The liver is supposed to be kind of tucked underneath the rib cage. So we reached the costal margin and I started to hear a little dullness. That's a normal finding. Next, we're going to be percussing for the spleen. So it's a very similar process. I'm going to start on your lower left quadrant, and we're just going to kind of be percussing, going back and forth, and the spleen is also tucked under the rib cage on the left side. So an abnormal finding would be if you started to hear dullness below that. You have dullness right where it should be, so palpating or percussing the spleen, you had some normal findings for that as well.
Well, that's good.
Yeah, it is good. The next thing we're going to be doing is palpating. So I'm going to start with some superficial palpation of his abdomen. Because he said he didn't have any abdominal tenderness, I'm just going to start in the right lower quadrant here. And just let me know if any of this is tender or it hurts. And I'm just kind of feeling to see if I'm getting any, like, I'm feeling anything abnormal, but also getting any, like, pain response out of him. And I'm not feeling anything. And then we're going to move to deep palpation. And this is when you can start to maybe palpate some of the organs if any of them are enlarged. I'm going to press a little bit harder, okay? Let me know if any of this hurts.
No more tickles.
Sorry. It can tickle a little bit. And that all felt fine as well. So I'm going to be, next up we're going to try to palpate the liver, the spleen, and the kidneys. So I'll start on your right side if you don't mind. To palpate the liver, we're going to be, let's go for the liver. Oh yeah. We're going to kind of start lower and be palpating up a little bit. And then you can kind of sometimes hook your fingers underneath the rib cage.
Oh, please don't do that.
I'm sorry. I won't if it's uncomfortable for you. But can I ask you to take a deep breath in, and then as you breathe out.
Yeah.
Sorry. Did that hurt?
No.
Okay. If there's a pain response, it could be liver, could be the gallbladder. A normal finding is that you're not palpating the liver in an enlarged liver. You might be able to palpate lower than the ribs. I was not able to feel John's liver at all. And then because we are on the right side, I'm going to try to palpate your kidneys. Okay, so I'm just going to tuck one hand underneath here and one hand above, and just try to relax as much as you can. And I'm just trying to see if I can feel the organ in there, which I cannot, which is a normal finding. I would do the same thing on the left side, essentially almost to palpate the spleen. The spleen, I would start in the left lower quadrant and move in some circular motions and go up to see if I can palpate that spleen. Like I said earlier, it's usually tucked up under the ribs, so you really shouldn't be able to palpate it in a normal finding. I'm not able to feel his at all, which is great. And then I would be doing the same thing for the left kidney on that side. I just am not able to really get over there, but a normal finding would be to not be able to feel your kidney in there. Then I would palpate the lower intestines, so I would start in one lower quadrant in some small circular motions. If I'm pushing too hard, let me know, okay?
You're not.
Okay. If it's causing any pain, let me know. And be feeling for any dilated loops of intestines, any air-filled intestines, any really hard ones. It can indicate like a heavy stool burden and such. And then the last one I would try to palpate is your aorta. So we would start a little bit over the umbilicus with my hand in like a C kind of shape. And if it's not painful for the patient can tolerate it, it's okay. Mm-hmm. You can try to palpate the aorta and feel the pulsation, which I actually can. That's kind of cool. Yeah. So that is abdominal palpation. Some of the special tests that we would be doing, if it was indicated, is testing for ascites. We can do a shifting dullness test and a wave test. So for a shifting dullness test, I would ask the patient, would you mind turning onto your side, whatever side is more comfortable for you, and laying on your side for a moment. Ascites essentially would be a fluid-filled abdomen, and fluid would be going lower than and air would be rising. So I'm just going to move your arm from it. You can have it here or whatever's comfortable for you. And you would be doing some percussion again. And you would be expecting to hear more tympany up above and more dullness lower, which might indicate that fluid has shifted as the patient has moved onto their side. You can lay on your back again. Thank you. And then a wave test. I'm going to ask for a little bit of your assistance with this. It'll be really easy. I just would like you to take your hand, and if you can, just like press down kind of like that on your abdomen. And I put hands on either side of his abdomen and then tap. And you can see if you can feel that fluid wave kind of coming through to the other side, which would indicate that there's excessive fluid in the abdomen. You can relax your hand. That hand there is just to block any like subcutaneous tissue from also creating a wave that you might feel in your hand and a stake for the free fluid. We would check for, sorry Cleo, we would check for cholecystitis. So a Murphy sign for cholecystitis, the gallbladder is located in the right upper quadrant near the liver. So I would put a little bit of pressure on your abdomen, ask you to breathe in and breathe out. And as he breathes out, and I'm continuing that like mild to moderate pressure, I might be able to feel the gallbladder, or the gallbladder might come into the pressure of my hands, and it would cause a pain response. So a normal response would be no pain for you. And then we would check for appendicitis. Sorry, Cleo. We would check for appendicitis. So the two ways we can do that is a Rovsing sign. If I was on the other side, it would be a little bit better of an angle, but I would kind of be able to press down. I'm going to put a little pressure on your abdomen. Press down and pull that fascia a little bit to the side. And if he had pain on the other side of his abdomen, that might indicate that he's having some appendicitis, some sharp, serious pain.
It's weird. That's
as I'm pulling the fascia down. The other one, it's kind of a similar technique, is on the right side. It's called the McBurney's point. Between the umbilicus and the iliac crest, you can kind of come down midway. And I'm going to put a little more pressure, take a breath in and out. And as I'm putting pressure on and releasing, if he had pain as I'm putting pressure or rebound tenderness, that might also indicate that he's having an issue with his appendix. But no pain response for either of those. Seems as if everything is normal. So now we're going to go on to the musculoskeletal part of this exam. So I am just going to ask you, if you don't mind, to just sit up again, and you can just sit right on this couch for me. Thank you. So we're going to be checking the shoulder, the knee, and the spine. So to start with the shoulder, I am going to just inspecting the shoulder. Again, he would normally have his shirt off. I'd be looking for... he'd be sitting on an exam table, so I would be able to kind of be behind him and see his back too. I'd be looking for any scapular winging, any discoloration, any swelling, any bruising, any scars, any wounds, nothing like that. I don't really see anything. I would be doing bilaterally as well, but for this video, we're just doing one side. And then I'm just going to start with some palpation of the shoulder too. So to palpate the shoulder, I'm going to start with his clavicle, and I would move along, and I just want you to tell me if any of this is tender, or sore, or hurts, or anything. I'm feeling for lumps, and I'm looking for any pain response from him. I'm not feeling any of that as well, which is good. We're moving along down his clavicle to the AC joint, which you can palpate right there. It feels normal there. And then we'd be moving on to the greater tubercle of the humerus. So if you just dangle your arm down, if you're having a hard time feeling it in someone who has a lot of muscle mass, you can kind of move the arm back and forth to isolate it, which it kind of seems like it's right there. The next thing we would be palpating is the bicipital groove. And then we would be going on to the posterior and anterior glenohumeral joint. So the posterior one, you just stand up straight, or sit up straight for me. You can kind of palpate it back like that. And then the anterior one comes down from the coracoid process and kind of curves anteriorly, or excuse me, laterally. And none of that is having any pain or anything, right? No? Okay, great. So then we'd be checking range of motion. So we're going to do some passive motion with you first. So I'm just going to be flexing your arm through some different ranges of motion. Elbow, shoulder, everything seems to be okay there. It's not causing any pain is really kind of what I am looking for him. And then we would be doing active range of motion. So it might be easier actually if you stand up for this one. If you don't mind, thank you. So we're gonna do some shoulder extension. So some shoulder extension or flexion. Oh, I can't remember. Okay, so still shoulder extension. So arms up. And then just bring them straight down. Okay, great.
I don't know why I was swinging them.
Shoulders, can you bring your shoulders back like that? So extension, bring your arms back. Shoulder flexion. And then some adduction. And then abduction. Great, awesome. And now we're gonna do internal rotation. So I'm just gonna have you face this way. I'm gonna bend your arm up like this, and then just move your arm in, like that. Great, and then relax your arms down. And then for internal rotation, we're gonna have you kind of bend your arm behind your back and then try to touch your thumb between your shoulder blades. Okay. And again, when we're doing this, I'm looking for any abnormal bulging, any scapular winging, any impingement, anything like that. I didn't see anything, everything looks great. Next, we would move on to some special tests for the shoulders. So we would be doing the Nears test. So I'm going to ask you, since you're standing, can you internally rotate your thing so your palm is facing back, and then raise your arm straight up in the air above your head. Okay, great, and then back down. That all looked good. I didn't see any, it didn't cause any pain or anything like that. And then we'll do the Hawkins test as well. So the Hawkins test is, I'm going to bend your arm at 90 degrees, internally rotate your forearm, and then I'm going to move, just try to relax your arm for a minute. I'm just going to move your arm kind of across your body in an up and down motion. And that's not causing any pain or any stiffness, no pinching or anything like that. The last one we're going to do is the drop arm test. Oh, my battery's low? I'm going to abduct it. And then I'm going to just hold it there and then just lower it slowly back down to your hip. And what I'm looking for in that is if it's causing him any pain, he can move his arm slowly. There's no jerking. There's no sudden weakness of the arm, dropping the arm. That'll indicate some normal finding. Next, we'll be doing the knee. So this one I would actually have you be laying back down for, if you don't mind. Thank you. So for the knee test, I'm going to be manipulating your knee a little bit, okay? So the first thing I would be doing is inspecting. Again, he would not have some pants on. He would be having some shorts on or some boxers or maybe in a gown. So I would be inspecting the color, if there's any bruising, swelling, abnormalities. I'd be checking the muscle contour, things like that. Everything looks good for me. And then the first thing I'm going to do is I'm going to palpate. So I'll be palpating the femur as it kind of comes in. And sometimes it's easier if the knee is bent up just a little bit to palpate the epicondyles and the femoral shaft. And then the tibia, the bilateral condyles, the tibial shaft there, as well as the patella, the patellar tendon, and the bilateral menisci. And then we would be checking some range of motion. Oh, and the IT band as well. So if you don't mind rolling on one side or the other again, doesn't matter which one. The IT band typically runs from the hip down to the knee and kind of crosses over. I'm just going to palpate it a little bit. You can feel it. Sorry if this tickles a little bit.
It does. But it's okay.
Down. Sorry. Just, feeling
tense.
I know, you are tense. Actually. Sorry. He's a little ticklish, so I won't keep putting him through that torture, but you can feel it kind of down. You have to palpate pretty deeply for it, or else you're just going to be grabbing skin. You can lay on your back again if you don't mind. So for some range of motion, we're going to be going through some extension, some flexion, and some other things for you. So I'm going to do some passive range of motion, raising your hip up. Just relax your thing. I know we already did this for the neuro exam, like that. And then I'm going to ask him if he can actively raise can you bend your knee up for me? And can you straighten your leg out? Great. And it's got ease of motion, no shaking, spasticity, anything that I can see like that. Did that cause you any pain?
No.
Okay, awesome. And then we're going to be checking strength as well, which we actually already did during the neuro exam, so we can kind of skip over that one right now. Then some special tests that we'll do for the knee is the Lockman's test. So this one, I'm going to be flexing your knee to 30 degrees, and I'm just gonna pull at your lower leg a little bit as I'm stabilizing your upper leg to try to see if I can feel kind of how your ACL is doing. Okay, so he's got kind of bigger thighs, but I'm just pulling that tibia anterior and posteriorly, and I'm feeling for a good hard stop against that ACL. I'm not feeling for an abnormal finding would be kind of a softer, mushier stop, and any pain. Did that hurt you at all? Okay. And then we're going to be doing the Apley's test as well. So this is the one that I told you that we're going to have you lay on your stomach for a little bit.
Sorry.
It's okay.
Ooh.
And then I'm going to bend your knee up, and I'm going to be stabilizing your thigh, and I'm just going to put some distraction onto your knee. So I'm pulling up, and then I'm going to be rotating internally and externally as well. Is that causing you any pain?
No.
And I'm looking for symmetry, any degree that I can rotate, as well as the pain response from. Thank you. You can roll back onto your back now. So that would be for the knee, and then actually the last one that we have to do is your spine. So if you don't mind standing up for me. Thank you. And you can stand there, I think. So for this, I am again just inspecting from the front and from the sides. If my house was easier to move around in, I would be able to see from the sides. And I'm looking for symmetry. As I'm looking from the sides, I'm looking for lordosis of the lumbar spine and the cervical spine. Would you just look straight forward for me? Any extremes in that? I'm looking for any kyphosis. And then, if you don't mind, I'm going to ask you to bend forward for me. Slide your hands down your legs and bend forward as much as is comfortable for you. And I'm just going to touch your back. I'm looking for like a straight shot of the spine, any bulging, any waves or anything like that. As we're doing this, we are also checking like he's got a good lateral bend. Not lateral bend, forward bend. So I don't have to worry about any flexion of his spine. Then I'm just gonna palpate down your spine, okay? And tell me if any of this is sore or hurts. I'm going from his cervical all the way down his thoracic spine to his sacral spine. And none of that hurt. And I'm also checking to make sure there's no abnormal bumps, masses, lumps, or anything like that. And I would be, if you can bend forward a little bit for me too, checking his extravertebral or perivertebral muscles, which all feel good. And I would again be telling him, is any of that hurt? Are you feeling any tenderness or any pain, any strain when you're moving?
Nope.
Awesome. So next we're going to be checking the flexion, extension, rotation of his spine. So cervical, I'm just going to ask you, can you, I'm sorry, you can turn towards me so you can see what I'm doing. Thank you. Can you raise your head up like that? And can you bend your chin down to your chest? Great. You can put your head back up. Can you put your head to the side, back and forth? Okay, great. And then can you just rotate your neck back and forth for me? Awesome. So flexion, extension, rotation, lateral bend of his cervical spine is intact. Did that cause you any pain? Did you feel any abnormal things when you were doing that?
Nope.
I didn't see any abnormal bulging or anything. And then for his, the rest of his spine, his lumbar spine, we already had him bend forward, so we know about flexion. And then would you mind just turning around and then bending from one side to the other, kind of sliding your hand down the lateral side of your thigh as far as you can go that's comfortable to you?
Oh, feels good.
Good stretch for you. That's great. And then you can just stay where you are. And then can you just try to keep your feet facing towards the front of the room, but then can you turn your upper body towards the left? And then to the opposite side. Great, and that's just checking for rotation as well. Awesome, thank you.